So in my practice, Picoway fills multiple roles. Most think of it as a tattoo removal laser, but it's much more than that. It treats benign pigmented lesions, and then the Picoway Resolve handpiece has really exploded the uses, including acne scars and fine lines and wrinkles. So it's a versatile, important part of my practice.
I do a lot of tattoo removal with Picoway laser, and by far it has completely revolutionized that space. It's far superior, in my opinion, to the previous generation Q-switched lasers. But beyond tattoo removal, I treat a lot of benign pigmented lesions, and especially in skin of color with the Picoway laser. And it's one of the only laser options really that gives me the confidence to treat these patients and know that I can deliver a very good result with minimal risk.
A lot of us are very familiar with nanosecond technology because that's really been the most commonly used device to treat pigment and tattoos, but there were limitations. And my limitations were that I couldn't treat all skin types safely, and I also couldn't predict what was going to happen to skin texture over time in those patients. This is the first time that I'm seeing skin tone improve, truthfully improve over time as that tattoo is disappearing.
Skin of color is where the Picoway really shines, in my opinion. I have a large sort of ethnic population to my practice, and the Picoway is in fact my go-to laser for many of their concerns. The ethnic patients tend to have a lot of pigmentary issues, and the Picoway laser treats those very, very well.
For me, the Picoway has completely revolutionized my ability to treat darker skin type with pigment issues or pigment conditions. So whether it's treating a tattoo in a darker skin type, I can do that with a little more confidence that I'm not going to do any harm. I can do things that I couldn't comfortably do before. So for me, the Picoway has been a tremendous addition to my practice.
Another reason why I recommend the Picoway laser is because it has a very good safety profile. And that gives me and my colleagues sort of the confidence to treat trickier cases. One very nice thing about the Picoway laser system is that it has two capabilities. It has the zoom capability as well as the resolve capability. And in combination, these two technologies are able to sort of give us a large degree of ability to transform the skin, improve skin quality, and treat a variety of different things.
Picosecond have much shorter pulse durations in the trillionth of a second. As a result, they can fracture tattoo ink particles to smithereens, and they do this by photomechanical damage, not with a thermal effect. As a result, there's less pain during treatment, less chance of hyperpigmentation after treatment. Recovery is about half the time that we normally would see, and the patients require half the number of treatment sessions.
Picosecond technology in terms of comfort is excellent because those short pulse durations create less of a thermal effect, which creates more discomfort. So thermal injury is often attributed to pain. So a quick, short pulse duration can provide improved comfort in tattoo removal as well as treating benign pigmented lesions. And when you use a Picoway Resolve handpiece, which is breaking up those picosecond pulses, you can treat acne scars and wrinkles with minimal downtime and minimal discomfort.
I practice in a large metropolitan city where social downtime is a critical factor that will determine whether the patient proceeds or not proceed with treatment. And so with my Picoway treatments, irrespective of the skin phototypes of my patients, I find that my patients typically just get transient redness and swelling for a day or two that can be covered by tinted moisturizer, tinted sunscreen, or foundation. I find that the Picoway laser treatments really can be part of that combination approach.
I very often combine the Picoway laser with other laser modalities. It blends in very, very well. For example, with the V-beam, it tends to be, in fact, complementary. And the combination of laser treatments with Picoway and other lasers tends to even give a better clinical result. I feel that one of the important factors that distinguishes the Picoway laser from other lasers in this class is its versatility and its flexibility in terms of how we can adjust every setting in the laser in an individual way to achieve a very tailored result for our patients. And that's very, very important. I would recommend it without reservation.
So why would any physician get Picoway? Well, if you're going to get any device, independent of Picoway, you should get the best device that treats what you're looking to treat in your patients. So if you have patients who need tattoo removal, who have benign pigmented lesions, who have acne scars or wrinkles, then you should use the latest and greatest technology, which is Picoway. The unique properties of that short picosecond pulse with multiple wavelengths allows you to treat all those things with minimal discomfort and short downtime.